Hi everyone, welcome back. Welcome back to Source Code. These are the wonderful founders around the world who have amazing human stories to tell, and that's what we try and film in these sessions. And today I'm joined by Ernest Darkoh. Welcome.
Thank you.
Ernest is the CEO and co-founder of a fabulous health tech company called Broadreach, and he's going to talk a little bit more about the company and what drove him to build it in the first place. And of course, all of your background that's helped you get to building this fabulous company. So welcome, Ernest.
Thank you so much, Annie.
Where did your desire to want to work in the healthcare sector come from in the first place?
Well, by background, my parents are from Ghana. I was born in the US, but from age 4, grew up in Tanzania and Kenya. So I've been a global person, from birth, essentially. Mm-hmm. And growing up in Tanzania and Kenya, I grew up seeing a lot of unmet need, a lot of suffering, and always had this sense that I want to be able to do something that makes a difference. At some point feeling like there must be a bigger way of being able to help people at scale. And I felt that I could do that by being a doctor, ultimately. So I decided to go into medical school, and I say halfway through medical school realized that if I'm going to make a difference in the environments where I grew up, like in Africa and other places, other developing markets, it's the systems that are actually broken, right? And I would need to learn to become a doctor of systems, not just of individuals. And that really set me on my path towards ultimately working with my co-founder, Dr. John Sargent, to set up a company that would focus on improving healthcare and well-being for populations on a large scale globally.
So taking a quick step back, so you studied medicine, you were originally going to become a doctor, and then you chose not to, and you chose to do something different. How did that decision go down with family and with the medical school?
Well, I am technically a doctor. I completed my medical degree, but I just decided not to practice, and I went into business afterwards. So I think doing something different, these are some of the things that make it difficult to be an entrepreneur, is that you're going often against family expectations, right? You're going against convention, where people expect you to follow a particular path because that path has already been laid out. Yeah. I feel it's a waste of a life to come in and simply repeat paths that have already been drawn out for you. I really do believe at my core that I have to, follow my own path, follow my own heart song, and find fulfillment in that way, but also make a difference in that way. And I think, luckily or unluckily, I've always had the ability to be the little kid who screams out, "The emperor is naked," And I think in public health in particular, there's a lot of naked emperors walking around, and no one's calling them out, and therefore no one's doing anything about it. So the systems are broken, and we continue to exist comfortably with these broken systems. We're conditioned to a broken system, so we never actually see that there's other ways of doing things. And I say fortunately, unfortunately, I'm not able to be comfortable with the status quo, and I feel we must change some things quite fundamentally. So often the message isn't easy because people get very defensive. And are you attacking doctors? Are you against the medical establishment? No, I'm not against the medical establishment. I am for wellness of populations, true wellness and health of populations in the world. And let us actually focus on how to remove the barriers that are keeping people from actually being well.
So let's talk about the company. So Broadreach, you started it in
2003.
So that's a long time ago.
Yes.
And I can imagine, 17 years, yes. A lot's happened in that space of time as well. And I think, if memory serves, you started off as a consulting and services business, exactly. And then it moved into being a tech company.
Exactly.
Help me understand what it's like to go from being specialists and doctors into being a tech founder when you don't necessarily, that's not where you started, right?
Yes. We spent the first 11 years of our existence trying to solve these problems the old school way. You go in, you put boots on the ground, in a consultancy mode, unpack what the actual problem is, try to get at the root causes. Once you identify the root cause of the problems in health systems, you then conceive the solutions You get buy-in on those solutions across the various stakeholders, and then hopefully you're able to implement those solutions. So we did this for over 11 years on the ground in some of the hardest environments, really trying to figure out how do you get implementation to work. All these lofty ideas like national health insurance or universal health coverage or primary health care for all. On a Monday morning, what does that actually mean? And how do you actually create the implementation around it, the process management, the process driving around it that actually gets this done? And we had encountered Ministry of Health after Ministry of Health with tons of nice plans, in a drawer done by the top consulting firms in the world. And no one is ever able to implement these on a Monday morning. So we really want to focus on doing this. Rolling our sleeves up and getting down there and figuring out how do you actually fix these health systems. It is too little that we're doing for too large of a problem that's overtaking us because we just don't have the ability to scale and get on top of these things quickly enough. And that's where ultimately John and I, after years and years of doing this manually, we looked at what we're doing and we realized that about 80 to 90% of what we're doing could be done through AI and machine learning.
Right.
And that would enable us to vastly accelerate the scale, the ability to scale, the speed of scale up, so that we could have much more global impact with the same staff, essentially. We don't have to grow much larger to have that global impact. And that's when we decided to invest our time in developing a technology platform that codified what we knew so that other partners around the world could now use this to improve what they're doing, and in so doing, we would achieve much bigger scale and impact than trying to do it by ourselves. So we knew what the technology needed to produce, for example. We knew that, for example, the technology needs to produce answers for a Minister of Health on a Monday morning that allow them to govern and manage better. The technology needs to produce the same answers then for the people who report to the Minister of Health, and then the people who report to them, and ultimately the people who are treating the patients in the clinics as well. So we created a technology platform called Vantage that basically does this. It's an intelligence layer that looks across all your data. It will triangulate across weather data, finance data, HR data, performance data for your clinics, and tell you what's going on. Mm-hmm. It will point out what's wrong. It will point out where it's most wrong. So for example, this is going wrong, but it's not equally wrong everywhere, right?
Right.
These, of your 5,000 clinics, these 50 are causing 50% of your problem. Those are the ones where you should spend your resources right now. And then in those 50, what is wrong? Mm-hmm. Our system will tell you what's wrong in those systems. Now you have to go and fix those 50 clinics that are causing the biggest part of your gap, and you need a best practice way of fixing that, and the technology then will provide to your distributed workforce who are supposed to do the fixing the detailed step-by-step workflow instructions on their tablets and cell phones of how to fix those problems. And then you can monitor it centrally to see who's doing what, where, and really provide the right level of oversight and accountability in a way that's unprecedented, which we could never do in the old school way. So that is the essence of the platform we built. And like you said, now in essence we found by actually still doing the work we're doing, by doing it through technology, we've become a tech company.
So in your business, you do an awful lot with systems and process redesign. I'm just really interested in how you've been able to manage or how you've been able to measure the impact of your solution, but also in those meaningful and tangible outcomes as well. How do you see that impact?
In terms of healthcare outcomes, for example, we've been deploying our system in South Africa for 6 years now, in a number of different districts. In one of the districts where we've deployed the system, it's given the management the ability to really unpack where things are going wrong in their HIV treatment program. This is Ugu district in South Africa. About 5 or 6 years ago, UNAIDS came up with the 90-90 framework. 90% of people who are HIV positive must know their status, 90% of those must be on treatment, and 90% of those in turn must have the treatment be successful, meaning their virus must be suppressed. Mm-hmm. By deploying Vantage in this particular district and using that to really zero in on where the gaps are and focus the scarce resources very powerfully on those gaps, we've been able to achieve the 90-90 in that district well ahead of the 2030 deadline.
And
So
how
this
many
is in
people are we
2019.
talking about here?
So that particular district is about 1 million people.
Well, that's incredible.
So-
Just going back to
Yes.
something you said earlier around, do you want to be a doctor and having patients and the impact that you can have on an individual's life? And now you're looking at how your technology platform has actually helped 1 million people.
Yes.
That must be incredibly fulfilling as a founder.
This is what you live for, right? And this is where you're willing to endure the 17 years of scars to have these moments where you actually have a breakthrough and say, look, it actually can be done, and it's been done in partnership, with the government. They've taken primary ownership of the program, but they've definitely been able to use our technology to the benefit of the population in Ugu.
Fantastic.
And of the global HIV epidemic, South Africa is the global epicenter. It is the single most infected country in the world, right? 25% of all of the global HIV is in this country. And in South Africa, the epicenter of the epidemic is in KwaZulu-Natal, where we are working. And then in the district I spoke of, Ugu, it's arguably had some of the highest prevalence figures in South Africa. So we're talking about ground zero of the epidemic. So these are the kind of places where you really need to be doing the right things. Otherwise, a lot of people die. And so for us, it's very fulfilling in that sense of the word, that we've been able to really show that by really focusing on the data and the analytics, and then well overseen implementation of good practices, that again, you use technology to help provide that oversight. It can be a game changer in terms of how we use AI and machine learning. It is supporting the existing processes so that you're actually much more effective in how you do them. And I think this is a way we need to think about introducing technology into systems, because otherwise it's seen as threatening, it's seen as too new. And we're saying, look, it can be done very simply and elegantly in the African environment. This is AI and machine learning, which is, the leading edge of what the globe is talking about to the technology. And we're doing it in Africa, and we're doing it well.
So you and your co-founder have been running the company for nearly 2 decades, and you've just recently made the decision to sort of take a step back and hire a CEO to come into the business. That's often hard for founders to do, to let go. So how did you make that decision, and how's that looking now?
Well, I think, interestingly, maybe unlike many other co-founders, we've always known we've never aspired to be CEOs.
Right.
It was never part of our desire to grow into CEO roles within our business. We wanted to solve healthcare problems, right? And that passion and drive sort of led us to forming a company and basically trying to run it as best as we can. But I think somewhere in the back of our minds, we've always known that we're not the best CEO material. We're not the best CEO DNA to be able to truly scale the aspiration that we have and make it successful. So our internal aspiration as a company is we want 20,000 leaders using our platform globally to improve the lives of 1.5 billion people. Now that's an internal benchmark we track against, and we're trying to hold ourselves accountable to. So we want to deliver this level of impact. When you think about the executives who run major corporations that deliver this type of impact, when we looked at ourselves and said, we can get things to a certain stage, and I think we've done really well taking the company to where we are at the moment, but we need help, right? We need help of people who are much more seasoned as executives to be able to now take us to the next level.
Right.
We are a social enterprise. We are a corporation, but we work at the interface of social, and public health well-being. So we're not if you bring someone purely from corporate, it won't work. If you bring someone from an NGO, it won't work. If you bring somebody, for example, who's only run large corporations, and yet we still have very much elements that are startup, it also doesn't work. So finding the right individual who could really take what we have at this stage and then grow it into the next iteration, it was key. It was key that we found the right person, but by definition, that skill set was going to be very rare. So it took us a while to find it, and I'm happy to say we have found it. And now it will reframe our roles. Of course, we'll still work in the company. We'll support business development. We'll support technical quality oversight. But at the end of the day, the skill set to really take this into and deliver on the game-changing global impact that we want Broadreach and Vantage to have, we knew we needed the next level of leader who can do that. And I think we have that in a gentleman by the name of Chris Legrand, who is just starting with us in about a week's time.
Fantastic news. And given that your company is nearly 2 decades old now, and there's been such a long sort of history of perhaps really interesting decisions that didn't quite work out,
yes.
or mistakes made along the way. And so, Ernest, I always ask this as the final question in these interviews. What words of advice do you have for founders out there, particularly those who perhaps might be struggling with the decision to be a founder in the first place, or maybe they're in the thick of it and they're just finding it really hard? What words of advice do you have?
My advice is to take that leap and go for it. There's been many situations, for example, where even when I think back to myself, right, and there was moments where I backed away from taking that leap, and I was like, well, I'm not ready. The reality is when you take the leap, what you need emerges to meet you and support you. It does not emerge when you don't take the leap. Mm-hmm. That's the interesting thing, right? So you have to be participating in that particular journey, right? And I call it your heart journey. You have to be on your heart journey for the right things to actually reveal themselves to you. And they were always there, but you had to walk out of your shell, take that leap to meet them, and you'll find that you'll have the support that you need. I really encourage people to have the courage to take that leap and step off. Now, I say, don't do it stupidly, right? Take into account all of the context around you, right? If you have a family, for example, or are you single, there's different considerations. And sometimes, yes, there's some things you have to make sure are settled before you can basically take such a risky leap. But that said, I would encourage people to take it sooner rather than later, because it does work out generally. If you're truly committed and you're truly following the path of your heart, it will work out. And in fact, your reaction is usually, I should have done this sooner. Right, so I really strongly encourage anyone who's thinking about this to do so. Second piece of advice I'd give people is to think about the kind of partners you need to scale up quickly and to really invest in setting up the ecosystem of those partners early, right? Because, for example, for us, being partnered with Microsoft has really enabled us to scale up a lot quicker than we would have. For example, the cloud service. Imagine us trying to build a cloud ourselves, right? So, the Azure cloud has, obviously made scaling up globally for us and being able to offer certain global offerings a lot easier. But more importantly, technical support that we've received, marketing support that we've received. And for example, as we sit here today, I believe we are Microsoft's largest ISV for healthcare for the Europe, Middle East, and Africa region.
That's extraordinary.
Right? And we would not really have achieved that without that type of partnership. So we know, we said we want to have global impact, we want to be a global player. It's very tough to do that as a small Africa-based organization without the right types of partners. And so again, I'd ask entrepreneurs, because there's a tendency to try to do it all yourself, right? You want to hold on to your idea, you don't want to share it, etc. But if you don't let go enough to allow oxygen in that fuels the flame to make it as big as you need it to be to achieve your aspiration, you technically could actually live and die very small.
Yeah.
And there's nothing wrong with that. Some businesses are meant to be small and work at that level, and that is absolutely fine. But if you do have a global aspiration in particular, or a continent-wide aspiration, I ask people to think very carefully between, are you going to do this all yourself, or are you actually going to do it through empowering others basically to do it? Sometimes also from a business perspective, for example, we welcome competition. It means more people are doing things in the right way, as now we believe, right? So one way of changing the game is, get a lot of competitors now doing things in this particular manner. It means more good things are going to happen for populations. So I'm not upset, and I don't feel I'm okay. I don't need more right now in my life, right? What I do need more of is to see good things happening in terms of positive transformation and wellness for populations around the world.
That's a fantastic set of advice. Thank you so much for joining us today, Ernest. It's been a pleasure learning about you and your company and what drives you. Hopefully the folks watching today have learned something, and we've helped just a few more founders keep going on their journey as well.
Thank you.
Thank you, Ernest. Thank you, everybody, for watching. My name's Annie Parker. This was Source Code. We'll speak to you again next time.